Assalamu alaikum.
Yeah, fine.
Assalamu alaikum, and welcome to the webinar series from Jinnah Medical University. This webinar series is on the topic of health profession education post-COVID. I am Dr. Shaul Sarfaraz, lecturer in Institute of Medical Education. The purpose of this webinar series is to share experiences, the challenges, and the solutions related to online teaching. This webinar is divided into two parts. The first part, and we'll be having the faculty from the Sindh Institute of Oral Health Sciences, Dr. Rizwanullah. He's the assistant professor. And we have another faculty from Professional Development Center, Institute of Medical Education. She's director of PDC department, and her name is Dr. Saida Zareen Raza. Both will be discussing about the experiences of online teaching and what lesson learned from that experiences. Then in second part, we have Dr. Syed Moin Ali. He's Director IME, who will be discussing about the tips regarding the online teaching that is happening. And then we have Dr. Saida Qasr Ali. She's Professor and Chairperson of Institute of Medical Education. She will be discussing about the role of institutions, Department of Medical Education, what are the roles and what should be done and what strategies should be followed in this pandemic situation. Now I would like Dr. Rizwanullah to start with his experience, to share the whatever the feedback he got, and what the lesson he learned by those.
Thank you very much. Thank you very much, Dr. Shaul, for introducing me. I am Dr. Rizwanullah from Sindh Institute of Oral Health Sciences. So let's begin. What the course is that I'm teaching at Sindh Institute of Oral Health Sciences through this online teaching method. I am teaching oral biology. In addition to my own subject, I am also teaching dental research and oral pathology and dental instruments as well. So I have started teaching online since last 3 years, and I'm teaching with the name of Dental Education Hub in addition to the university teaching that we are doing through Google Meet and Google Classroom. So I'm teaching through YouTube, Instagram, and a website, and all of them are with the same name. So let me show you the interface that how these all these three platforms they appear. So this is the website, and in this website I share blogs. I write a small essays in writing form for the students. This is the YouTube channel. In this YouTube channel, I upload small videos, 10 to 15 minutes. So it will be easier for the students to understand the concept through video lectures. And some of them, there are the screen recordings, and some of them are the actual demonstrations. This is the Instagram, very popular among the young generation. What usually I do is I share the multiple choice questions that are another way of learning. And in addition to that, I also share images that are another important tool for learning as well. What are the softwares, what are the technology, or what are the online modalities that currently I'm using? I'm using for the screen recording, I'm using the flashback software. There are a number of softwares as well. For video recording for if you are demonstrating something. So for video recording, we are using Adobe Premiere Pro and Adobe Photoshop. So if you want to edit some image, so I use Photoshop as well. I use Google Keyword Planner. So what Google Keyword Planner it does it tell you the number of times a term is searched by the learners. So what I do is I plan videos according to the Google Keyword Planner. So if a video is if a term is searched by 1,000 students, 1,000 learners, so I make video for that on priority as compared to a term that is searched by 100 people. So this is how I use Google Keyword Planner. So far, the online teaching experience, it is good because in the online teaching, it is beyond geographical borders. So it is not the classroom where you teach 50 or 250 students. So online teaching is beyond geographical borders, so it is very exciting. And students can learn at their own pace, so whenever they want. So as compared to a classroom where you have only limited number of students, so online teaching is therefore very exciting. There are several challenges while I teach online. For example, the technology, the old technology, you have to unlearn. So you have to learn and you have to unlearn. So you have to unlearn the old technology. This is the example of an old technology, and you have to learn the new technologies as well. And this process it continues. The learning and the unlearning, it continues. And you have to modify your PowerPoint presentations, the old ways of teaching or the old PowerPoint presentations, and you have to modify, and I have to modify it for the online teaching. So these are the few challenges. What the learner feedback that I got in forms of email or in form of comments. For example, this is one of the picture of a learner feedback. So in which the student is saying, oh my God, thank you so much. You made this so easy for you to understand. I wish you were teaching my anatomy class. So this is the power of the online teaching. So somebody is wishing that you would be my teacher. So another example is here. Thanks for this. You explain it more clearly than my tooth morphology lecturer. So a dentistry student from New Zealand. So this is the power, like it is beyond the online teaching, as I said, it is beyond geographical borders. So sometimes I got negative feedback as well. For example, this one, which someone who has a nice accent would describe. So sometimes I got negative feedback as well. I don't delete negative feedback and we take it very positively, and I try to improve as well. So, are you interested in online teaching? But I think there's a no point of whether you are interested or not. It is a new normal. The online teaching is now a new normal. So you have to be interested in online teaching. So if you want to teach online, or if you're teaching online, you have to learn new technologies. You have to learn video editing skills. You have to learn IT skills as well. So otherwise, you will be excluded very soon. So you have to make some new friends for online teaching. Your friends may be your colleagues, IT experts, medical education experts. You have to take the advice from them, both the IT departments of your universities and from the medical education departments. And you have to develop a long-term collaboration with them, a long-term friendship with them. So in 2020, you have to make some new friends as well if you want to teach online, or if you want to be successful in online teaching. So this is the end of my short presentation. So thank you very much.
Okay, thank you so much, Dr. Rizwan, for sharing your experiences. Now I would like Dr. Zareen to please share her online experiences about online experiences.
जी बिस्मिल्लाहिर्रहमानिर्रहीम. Thank you, Dr. Shaur. And I would tell you that my name is Dr. Sayyada Zareen Raza, and basically I teach general surgery to the MBBS students final year. And moreover, I'm looking after all the online classes for all the years of MBBS as well. Okay, so when the pandemic started and we had to rush for the online classes, so initially we opted for the Google Classroom, and in which we have been uploading recorded lectures. But then we received feedback from the students that they want interaction with the teacher so that they can ask questions and clarify their concepts. Then we started synchronous sessions through Google Meet. So currently we are running synchronous sessions through Google Meet, while asynchronous sessions through Google Classroom. And during all this period, basically our sole focus was how we could enhance the effectiveness of our online sessions. For that, basically, when we started to develop recorded lectures, what did we do? We started to use screencast because we were using Camtasia for the recording and editing. So in that there is another product, Screencast, that is basically free. 2 GB space is free, and you can use it, and you can see that there are different questions and student has to answer, and if the student answers incorrectly, the video would play back. You can see the scroll bar that has gone back, so that the student has to revise that concept again. So this is wonderful technique, and we received a positive feedback from the students, and we and we applied it to the online classes as well. For example, for past couple of years, we have been using Socrative and Kahoot. So we started to use Socrative and Kahoot in the online sessions, and so that we were posing different questions and students were answering, and we had real-time feedback so that we could understand which concepts need to be elaborated more. So that is really wonderful, and we received very positive feedback about this, as we have been receiving for our physical classrooms. And we have at Jinnah Sindh Medical University in the anatomy department, we have sector visualization and dissection table. Basically, this table has thousands of 3D realistic images, and in the pre-COVID period, it was in regular use, but then we thought that we could use it for the online classes as well, and so that we connected it through the Google Meet, and now there are regular classes on the sector table, and you can see that these wonderful images the student they can see from their home as well. In this, there are several options that if we want to remove anything, we want to rotate it, we want to expand it. So there are several options, and this is really very important for the learning, and we received about this wonderful feedback from the student that has enhanced their learning too much. Another very important thing, as I said earlier, that we used our physical classroom experience for the online teaching. So we also plan integrated interactive lecture for online sessions, and that is supposed to be delivered inshallah next week, and we have tested and tried, and the results are wonderful, and hope that we will have good feedback as we have been receiving good feedback in the physical classroom. Uh, Another very important thing that we did, that is team-based learning through live sessions. This was really very difficult initially because we had to plan a lot, but we received very positive feedback from the student in this. Actually, for the individual as well as for the team readiness assurance test, we have incorporated socratives, and through this the student, they are doing test, and we are developing multiple classrooms so that we can incorporate different groups in those classrooms, and they can discuss the topic well there. So we have received very good feedback. I can just show you here the feedback of the students. In the first feedback, you can see that this is about the sector table, in which the student says that this is the best step which has been taken up till today for the online sessions. And another thing I will just show you that in this, in the second and in the third feedback, you can see about the team-based learning, that the student, they are saying that has reinforced their concepts, and they learned a lot and enjoyed simultaneously. And that is the purpose, that we are making the sessions attractive for the student so that they are learning in a fun way, and their concepts are clarified more. And what do I suggest? That whatever technology you people are using, just try to stick to that one and explore different features, and try to think out of the box. How can we use these features? And the other thing is that try to use your physical classroom experience for making the online sessions effective. That is my suggestion, and thank you very much.
Okay, thank you so much, Dr. Zareen, for sharing us the experiences, and I'm highly impressed that we have done a lot of things in Jinnah Medical University. Now it's time to take some questions, but I cannot see any questions here. If attendees can please put up some questions. Okay, I think we should start the second session. I would like Dr. Syed Moin Ali to please share his tips and on the online teaching.
Assalamu alaikum. Welcome to the webinar by Institute of Medical Education at Jinnah Medical University. I have been just so amazed at listening at the previous two speakers, just excellent icons of modern day teaching. So in March this year, the entire country was plunged into choppy seas, and we were shut off because of valid reasons. And we were told that now teaching would be online. And that really threw many of us off, except probably these two very well trained and highly motivated professionals. But most of us didn't know, many institutions didn't know what would happen and how they would not waste student time and engage student positively in learning and ensure that learning is of good quality. So my presentation really is about emergency teaching, which is remote, it's not on campus. So online can be actually on campus and online can be remote as well. So I'm going to concentrate on remote teaching in emergency situations and what some people have done, what I have done, what literature says, very briefly, very simply, so that people can learn and maybe follow. Okay, so I would like to discuss the challenges faced during online teaching. And of course, I will also help in offering some solutions um, based on literature and my own experiences. All right, the first thing that I noticed was that because we are people of habit, we had started enjoying the face-to-face sessions that we did, the lectures, and we could modify and adapt our teaching based on the facial expressions of the students, based on the feedback that we got immediately from the students right there and then. So this is one problem, this is one reality of human nature, that we get used to things that we have been practicing. And this now suddenly that the system changed 180 degrees, many of us were at a loss of what we would do now and how we would be able to do just as well as we were doing in the past. The second issue that we had was that we were unable to let go of our habits, as I just said. Do you remember, many of our faculty members would remember that there was a time when teaching used to happen on blackboards. So our professor of anatomy would draw diagrams on the blackboard to explain to us. Then came those acetate sheets, transparencies, and lectures would be written on transparencies. And then came the PowerPoints. So when we shifted from acetate sheets or transparencies to PowerPoints, we were pretty unhappy about it. We were so used to our transparencies, and people had stores and stacks of transparencies of their lectures with them. So that was a very unhappy time. Now also, many would be unhappy because you have to let go of your ability to stand next to your PowerPoint and explain physically, but now you have to do things online, and that's a completely new ball game. It's a completely new turf for us. So we need to be ready mentally to accept that there is change now, and to accept that we need to learn new skills in order to continue delivering high quality education to our learners. Now, the next question comes is what do we do? Okay, fine, we've accepted what the reality is, and what do we do? Because what we don't know, we cannot foresee. So I would recommend that we go to Uncle Google and we search. For example, we can search for things like how to teach online, how to make teaching effective online. What things, what technologies, what skills are needed by faculty today to make your teaching effective. Another thing that we need to consider is that today's learner is quite different from the learner 10 years back. Our students were ready for sitting through 1 hour lectures, but I am sure you must have noticed in your classrooms, many students would start fidgeting with their mobiles soon after the lecture started. This is the current nature of today's learner. They have short attention spans. So if we put an online lecture of 1 hour, they will probably log on and go to sleep so that their attendance is recorded. But they feel that because there is a video available and YouTube is there and so many support facilities are there, if they know the objective, they can learn on their own and they don't need to sit through the lectures. So if you attend any classes yourself, if you take an online course, for example, you will see that the lectures are of a very short duration, half an hour or less, because that is the current way of teaching. Short lectures, multiple lectures, sequentially placed, very well organized, but the essential thing is that they are of short duration and they engage students very well. So student engagement is a very important issue. We have to learn how to engage students. Many of our faculty members are afraid of technology, and that's why they shy away. They ask for assistance. They want to do the bare minimum just to get over with the task. But I really recommend this Mountain Dew logo, that if you know, beyond this fear is where the real fun lies. And as my colleague said earlier, start simple, but start learning new things. That is very well said by Dr. Rizwan, that we have to unlearn our skills and we've got to relearn. And that is what we are doing. And there's no real hurry, there's no emergency, because this is here to stay. This is a long time thing. We're not going to go back 100% to face-to-face, even in the post-COVID period. So these technologies would be helpful for everybody, whether you're very senior or you're just starting your teaching career as a health professions faculty. We need to learn new technologies. We've heard very new names now, like Socrative, Kahoot from Dr. Zareen, and Adobe Premiere Photo, and so many other terms that we have learned. You don't have to learn all of these, but the readiness to learn, the mental readiness, the mental aptitude to learn new technology, just like once we all learned PowerPoint. So we need to learn new technologies in order to continue providing high quality education to our students. Once we learn these, of course, we've got to keep on using them, and we will face problems. So don't be afraid of problems. Don't be afraid of challenges. Don't be afraid of glitches that you will experience. There is help around everywhere. Every institution has an IT department. Every institution has people who know something or the other about technology and new ways of teaching. So please collaborate with them and please take help. Don't be afraid of taking help. Don't shy away and keep practicing. So once you keep practicing the new software, the new app, the new method, slowly and gradually you will improve. And as I said before, there is no urgency. Start, definitely, but start simple and start slow. Work according to your pace of learning. It doesn't have to be very fast. Again, with the help of people, if you are unable to decide yourself, with the help of people, select a software that you can learn which is simple at the start and then go to complex. And please keep practicing. People who have learned to use a software are the best teachers because they have experience. They have been through problems. So select somebody who doesn't know just the theory of it. Select somebody who has actually taught students by using that software. Of course, you will need the help of IT people. The IT people are our new friends. We have to make them friends. You can't do without them. So with the IT person, with a faculty member who has experience, learn the skills. This way, you will reduce the chances of making errors on your own. When I started learning some new softwares, I made a lot of mistakes at the start. I was not very good at putting PowerPoint online or doing voiceovers or video recording over a PowerPoint. But with time, I learned, and I started making my videos interactive for some postgraduate students, for other audiences. So it took me quite a bit of time. It took me easily 10, 12 sessions before I could actually be a little satisfied with the quality of my own product. But I took help from people who had done all of this. And I am not ashamed to say that some of those people from whom I took help were actually much junior to me. But it was fine. I really enjoyed the learning process because I felt proud and happy that I have acquired modern day skills. So please select your new help, new person who will guide you very carefully, very nicely. So in order to summarize, we have been plunged in very difficult times. We all understand that. But we need to adapt. We need to understand who we are teaching, what is the psychology of the learners, and we have to learn new skills. That's very important in order for us to continue delivering high quality education. And I leave you with one last thought, and then we'll go over to back to Dr. Shaur. So thank you very much for listening.
Thank you so much, Dr. Moin. Thank you so much, Dr. Moin, for sharing your views and the tips. It is really very helpful. Now, I would like Dr. Saida Kausar Ali to please tell us the roles of medical education departments and the role of the health profession departments.
Okay, I had to unmute myself. I always forget that. So anyway, Assalamu alaikum. Good day to all of you. So I am basically going to talk about the role of institutions. As my earlier speakers have already alluded to, this is a change, and every change needs support. And the support that we need is from moving from this blurred online education background to something that is more concrete and something that is more clear to us. So, okay, now I again need help to move forward. Is there a second? Okay. All right, so moving to this, we have all listened to this, that my earlier speakers have talked about having very engaging courses, and Dr. Zareen talked about that. Dr. Moin has talked about the faculty readiness. Both Rizwan and Moin have talked about technological requirements. So I'm basically student readiness is students are ready. Students have a very good processing capacity. These are the millennials. They know how to work with technology. So I'm basically going to talk about institutional commitment. When we are talking about commitment, I think one of the very important thing is having the foresight, having a vision, being ready to embrace the future. If we are rigid and we do not try to embrace the future, we are going to be left behind. Along with that, of course, if we embrace future, we may need to go back and go to the blackboard again and look at our goals, look at our vision statements, because everything has to be aligned. JSMU has been very fortunate because it has recently revisited, it's a relatively new university and has revisited the goals and vision, mission statements, वगैरह. So we are very much ready to embark on this. Along with us, an institutional's one of the main responsibilities is providing a learning environment that will facilitate online learning. So we will go into the details of the environment a bit later, but a lot of things are associated with environment. Of course, Moin has talked about teamwork, Rizwan has talked about making new friends. We have to make new friends, and all of us have to work in unison to make the thing work. If even one person does not participate passionately and in the right direction, the pattern will break, and probably we may not be able to, reach our goals. But I think the foremost thing that is required is the readiness and the readiness of the institution to put in money to fund all this. This does not come in cheap. So yes, it requires funding, hiring of people requires funding, having the technology available requires funding. So there has to be a readiness to put the money where you want to go through. The next thing, of course, so going into a bit more essential requirements is again doing the right thing and getting the right person to do those things. I've already talked about alignment. IT department has become an essential. It was already there. Sometimes it was just as a, just as an appendage, but now IT has taken the main stage. And so IT, along with content experts and along with instructional designers, we are a team that thus needs to move ahead, and therefore the institutions have to invest in this. Now, IT personnel are quite expensive, okay? So IT personnel have to be taken in, and if you take them in, if institutions take them in and they don't want them to run away, one has to invest in them. Instructional designer is another member of the team that needs to be hired by institutions. If you don't have them, I have heard that in Pakistan there are only 18 instructional designers, so you need to train your staff into instructional designing. So that takes care of the personnel development. Personal development is of the students, is of the faculty, and of course, your staff to do them. Learning resources need to be available because the learning resources not only have to align with what has to teach, but also have to be easily accessible. They have to be easily retrievable by people, and they have to be available whenever students need them. So availability, accessibility is essentially important, and the institution needs to have facility and space for these things to be available. So you need more bandwidth, you need more internet access. When I say involvement of stakeholders in communication, this means that the institution needs to involve the students, the faculty, the parents. The parents need to be involved into this, and the vision, new goals need to be communicated to everybody. We do not work in silos anymore. We have to work together. The days of working independently are gone. Now it's interdependence and working together that is going to lead the way. And of course, not forgetting our students. Please don't forget the students. They are the end users. They are the ones for whom we are doing everything. Ultimately, this is all going to boil down to better patient care. So students are our main focus. Coming to the roles of medical education departments have usually, they see themselves as leaders, okay? We see ourselves as leaders, as guides, as advisors. However, many a times we have to work with the people. Only advising doesn't help. So the people who are in medical education need to go forward and carry and take the hands of the people. Sometimes we have to do hand holding. We have to do hand holding and then work with the people. Sometimes we have to wear the workers' hat. We also have to become workers. We can't sit in our offices and tell the people to do A, B, C. So for that purpose, we need to build our own skills. We need to learn how to do things in order to tell people how to do it. Of course, we are all teachers. So we need to change from the traditional teaching style and change our own style and embrace the online education. You have to demonstrate what you're preaching. You have to walk the talk and not just talk about online education. And when we come to do sessions, we are still using the whiteboard and the PowerPoint presentations. The way people see us is generally like a glutton, oh my God, medical education people, they are going to come and they're going to say, yes, I knew what, this is not right, that is not right. But we want to do evaluations, but all these evaluations will hopefully tend to improve the online education. Coming to the nitty-gritties, really. So we, as medical educationists, we need to work together with the policymakers. We need to include the educational aspects and put our part into it. Advise and innovate. Be innovative ourselves. Think out of the box. We need to do our own personal professional development. So the chairs of medical education departments then need to invest in the capacity building of their own people. We need to do faculty trainings. That's a must. We have been doing it, but we generally tend to forget the students. So it's very important to take the students along. So some things we've been doing course review, but now we have to look at the courses with the view of putting them online. Assessment is something that is very important, and we have to go hand in hand with the assessment. And last but not the least, I think it is very important for medical educationists to take this as a research agenda, to study the change that is happening and then to publish so that we are able to learn from each other. And I'm very hopeful that working together with institutional vision, capacity building and support of the medical education departments, the e-learning horizon will become more clearer and we will be able to reach the quality of e-learning and online education and remote online education that we are aspiring for. So best of luck to all the teachers and all the institutions. Thank you.
Okay, thank you so much, Dr. Kausar, for sharing your experiences and the roles of medical education. It was really very fruitful to listen to you. Now we would like to take some questions. We have some questions regarding assessment. We will be having another webinar series for that. And I would like to take a question from Dr. Akil Makbul. How have you made teams and what was the number of students in each team for TBL? I would like Dr. Zareen to please clarify this. Can I repeat? Should I repeat the question, Dr. Zareen, for you?
And question.
Okay. So we have another question for Dr. Saida Kausar. So in future based, Dr. Kausar, I have a question for you. So in future, based upon feedback, you think physical presence of medical school will become redundant?
Thank you very much, Shaur. But as far as I'm concerned, I personally feel that it may not become redundant, but it's going to be value added with a lot of online education. So what teachers will be doing is that a lot of things that they can do and put online will be put online as whether asynchronous learning or say synchronous learning, and the teachers can spend more time in doing things that need to be done with the students. So students may be spending much more time in discussions, deliberations, in learning of skills, in team-based learning on physical premises, and all the knowledge-based things could be easily learned from online education. So it's not going to go away, but I think it will add on benefits.
Thank you so much, Dr. Kausar. I have another question from somebody anonymous. How can we overcome difficulty in delivering psychomotor skills in online teaching? I would like Dr.
Hello, can you hear me now? Yeah, psychomotor skills have two components. Number one is the knowledge base of the psychomotor skill, and that can be given online. For example, even a demonstration, a student can watch videos about any skill. Let's suppose it's about wire bending in dentistry or tooth extraction or scaling, or in MBBS it is about performing an abdominal examination or passing a chest tube, an NG tube. So the knowledge part of it can be done online, but there are issues that cannot be deferred to online. For example, physical examination. For example, actually, listening to the heart sound of a patient with a certain murmur, and then reporting. So some aspects can be done online and some aspects cannot. And the school has to decide how it will blend the two. So in the current situation, till the time that universities open up, we can deal with the knowledge part of skills, but we will have to defer the hands-on part till the campuses reopen. Thank you, Dr. Shaw.
Okay, thank you, sir, for clarification. I would like to ask the question again from Dr. Akil Makbul. From Dr. The question is for Dr. Zareen actually. How have you made teams and what was the number of students in each teams for TBL? And somebody who is anonymous wants to ask that can you give some more details about TBL? Please, Dr. Zareen.
Okay, thank you very much for the question. Basically, we took advantage of the already created clinical groups in which we have major groups and the minor groups. And in the minor groups, on an average, we have 8 to 10 students. So basically, what did we do? First, we took an orientation session of the student, and then on the day of the TBL, first I started a socrative that is the individual readiness assurance test. When they did it, then they were allowed to enter into the classroom. For that purpose, I created multiple classroom according to the number of groups, and then they were allowed to discuss on mic. And after that discussion, then I started a team readiness assurance test through the socrative again. And then we started a discussion amongst ourselves, and then we clarified all the concepts. And I just showed a few slides if that were needed. So that is the whole process of the TBL. I think that suffices.
Okay, thank you so much, Dr. Zareen. We have another question. I would like Dr. Moin to reply. In present day context, do we need to have permanent full-time faculty? Outsourcing of teaching sessions can be done?
Thank you very much. I think this is a policy matter. So it is the institution which has to decide. There is no, I personally, I don't see any harm in having people with great talent and expertise on board. So there's always visiting faculty. I mean, even when there was on-campus teaching, there was visiting faculty. So this can be visiting faculty as well. There's hardly any difference except that now they may be online totally and not coming on the campus. But I would like Dr. Kausar's view on this as well, please.
Okay, thank you, Moin. I think it's not only institutions policy, it will depend a lot on the accrediting and regulatory bodies. So because the regulatory bodies require a certain number of full-time faculty, both HEC and Pakistan Medical and Dental Council, and I think Pharmacy Council and others, they do require a certain number of full-time faculty. However, yes, we have always had, we have been using online faculty, visiting faculty, guest speakers, so they will still continue as it is. Only the modality of instruction may change from face-to-face to online.
Okay, thank you so much, Dr. Kausar, Dr. Moin. We have another question for Dr. Kausar. What could be the proportion of just presentations, voice-over presentations, and online interactive sessions for medical students in the present scenario? What could be the proportion of just presentations, voice-over presentations, and online interactive sessions for medical students in the present scenario?
Okay, I think the answer to that question is basically it depends on the objectives. You cannot decide and give proportions to it. All depends upon what is it that you want to achieve. If there is something that can be is just reading and understanding the text, then you can do it asynchronous. But if there is something where you want the students to be interactive, to participate, to have engaging, then you need to have online synchronous sessions. Saying that, we all know that learning is best when we engage students, when the learner is engaged in the learning process. So I myself am a person who is, from the old school. I come from the old school. I have learned new skills, but I've come from the old school, so I'm more comfortable in synchronous teaching sessions because I can interact with my students at the time that it's going on. However, I've learned that a lot of engaging things can also be put on in the asynchronous sessions. And so the online courses that we are now putting, we are putting things over there for the asynchronous sessions where learner engagement can be enhanced by using many different modalities.
Okay, thank you so much, Dr. Kausar. We are out of questions now, we have one more question left, which is not relevant to the teaching online. But yes, it's important to know that what is the use of instructional designer in the context of online teaching. So I'd like Dr. Zareen, Dr. Kausar to
Yeah,
answer? Okay,
yeah.
Dr. Kausar
Yeah.
can answer this question.
Thank you. Thank you. It's because I had mentioned instructional designer, so you passed this question to me. Thank you, Shor. You see, we are content experts, so right? We can develop the content. We know what we want our students to learn. We have the objectives. We can even say that, okay, I would like to embed a video over here. I would like to embed I would like to do a role play, record it, and then place it over there. Right now, all these things, to embed all these things in an online medium, an instructional designer is very helpful. I am very privileged to have an instructional designer in my department, in my institute, and we are benefited by him immensely. I mean, when we were trying to do synchronous, asynchronous, and even now when we are trying to develop online courses, I just discuss with him, and then he tells me, okay, ma'am, here you can use a hotspot, here you can give me the video and I'll upload it over there. So the finalization of everything, we cannot do everything. We need a team. So yes, I have the know-how of it, and many content experts may learn about these things, but actual doing of it takes time. And if there is somebody available whose task is this, I can spend more time, more beneficially in devising no more content rather than putting it online. So instructional designer basically visualizes how the things go on the online course and helps us put them and embed them on it.
Thank you so much, Dr. Kausar, for explaining it so well. And really, we need some technical resources, human resources, to deal with all these online teaching and all, because it's a bombardment on us and we have to deal with it. Okay, now we are coming to a conclusion. I would like Dr. Saeed Moeen Ali to conclude the session.
Thank you very much. I think this has been a wonderful session, very smooth and informative. I'd like to thank our IT friends for helping us throughout. We started today with Dr. Rizwan's brief but very eloquently put and informative session of his experiences, where he uses various methods, like he has his own website, Instagram for putting up MCQs and images, and he uses YouTube for videos. So he's really tech savvy, and he's been using software since 3 years, like Flashback and Adobe Premiere Pro and Photoshop. And he does a very wise thing, that he looks up what people want through Google Keyword Planner. And his online experience has been very nice, and he showed us his feedback, which was mostly positive, and he gave us some negative feedback also, which he got, and he learns from that. I think that's really excellent. What he suggests is that we all should learn video editing, and we have to learn IT skills for working well in the current situation and in the future. Then we went to Dr. Zareen, who's a general surgeon and is responsible for online MBBS classes, putting classes online for SMC. So she has been using softwares as well, like Screencast. She has used a lot of formative tests. She's used Socrative and Kahoot very well, so that she gets real-time feedback and she learns from them. She's able to modify the content a bit based on learner feedback. And then what she's been able to do is she's been able to integrate Sectra for online teaching. Initially, Sectra was used only for physically present students, but now it is there for remote teaching as well, which is wonderful. And there's a lot of positive feedback from students about it. And another exciting thing that she's done is that she's done team-based learning online by using Socrative. So I think that's the highlight of this webinar, that we have been able to present two examples of modern day teachers who are very tech savvy, who are very motivated in continuing to provide education to students. One of the things that Dr. Rizwan said was that what he likes is that now his horizons are much broader because he's not catering to students in the room, he's catering to people across the world. And that's what excites him. Dr. Zareen suggests that we stick to technology and we explore different softwares and we learn from the softwares. Then came my presentation in which I really talked about how people have responded to this sudden change and how we need to adapt ourselves, how we need to be ready for individual professional development and learn new skills, learn new softwares, practice them, collaborate with others, make IT an essential, relevant, needed component of our professional day repertoire of skills. So that was about my session. Dr. Kauser talked about institutional commitment, and what she emphasized on was investment of the institution so that there is alignment among what the vision of the institution is and what the institution does and what the institution plans to do in the future. So that was a very big key feature, key point in her talk. And then she also talked about essential requirements, having instructional designers who can use softwares to put courses online and make the courses better. And she also talked about personal development, getting to know the learning resources and ensuring that we have access to them. Another main emphasis on her talk was on student involvement and not forgetting the end users, because students are our focus, as she said very rightly. Then she went on and talked about the departments of medical education who are self-proclaimed leaders and who have to take on a more active role in not just advising, but as she very nicely put, hand-holding, which means supporting the faculty in development. And in order to support the faculty in their development, they have to first develop themselves. They have to first have their own professional evolution, their own self-capacity building, so that this online education system can be developed, because as she said, it is now all integrated, it is all interdependent. We cannot work in silos, we have to work together, and I think that is the bottom line of our webinar today, that we have to work together and we will do very well with each other's support so that our graduates are just as good or even better than before, and our healthcare delivery is up to the mark, and the morbidity and mortality in our community and in the world reduces through the efforts. Thank you so much for attending this webinar. I thank everybody, and we hope to see you again in future webinars. Over to Dr. Shaur.
Thank you so much, Dr. Moeen, for concluding the session. Very well said. Now, actually, some people are asking to have this video of webinar. We will be putting it and uploading it on Facebook after 2 to 3 days, and also on JSME website. You can get it from there. And Dr. Laikus Zaman is asking that if there's a separate session on how to engage students in online asynchronous sessions. So we will be having some other webinar series for that as well. Right now we have discussed about the experiences of online teaching. Thank you so much for attending the webinar. I would like to give the Dr. Kauser to say something, and we can end up the session.
Okay, thank you very much. All of you, see you again in the next webinar that we are going to announce soon. And I hope that this thing goes away and we are able to, be more comfortable in situations where we are. All the best to all of you. Keep safe and keep on learning. Bye-bye.
Thank you.